Greetings everyone, and welcome to my channel, Take Control of Your Health. I'm Dr. Corey Stern, and if this is your first time tuning in, I'd like to extend a warm welcome to you. I do recommend that you take a look back at the other videos that I've posted, as all of them contribute to helping you to live the healthiest life possible, and that is the purpose of this channel. And to also help you not to fall victim to all of the bad stuff that the bad guys are putting out there to try to make you sicker, weaker, and stupider. And if you're returning, if you've been subscribing and following me, thank you so much. I deeply appreciate it. I hope that you're getting a lot of information here that's helpful. So today's topic is protein. And that just sounds so boring. It's just not like a sexy kind of topic, protein, but it's a lot more important than you would ever imagine. So I want to go into some details about protein, what exactly it is, and what it does in your body so you understand the importance of it and you can make the best choices. So first, let's talk about what protein is. Protein is made up of amino acids. There's actually 20 different amino acids that are put together in different combinations and make up all kinds of different proteins in your body. And out of those 20 amino acids, your body can actually manufacture most of them if you're eating protein foods, which we'll go into in detail. But there's 9 of them that your body cannot make. And those 9, it is very important for you to be eating foods that have enough of those 9 essential amino acids. So before we go into that any further, I just want to tell you what the function of protein is in your body so you understand why this topic is so important. And basically, most of your body, your stuff is made out of mostly protein, right? So a lot of times when I ask people, do you know what your body is made out of? Their automatic response is water. And it's true that a lot of your body is made out of water, and water, of course, is essential. You can't live without it. But if you were only made out of water, you'd be a puddle on the floor. So protein is really kind of what ends up holding you together. So your teeth, your bones, your skin, your hair, nails, glands, organs, your muscles, your blood and other body fluids are all made out of protein. Oh, your immune system too. So you probably have all heard of antibodies, right? Antibodies are protein. Antibodies are what your immune system produces when you've been exposed to a pathogen, and the body creates a response to that pathogen. Pathogen meaning germ, virus, bacteria, parasite, fungus. Your body responds by making an antibody, which then tells the body not to allow that pathogen into the cells. So you can see if you're not getting enough protein and you can't make antibodies, your immune system's not going to work. Here's another example: hemoglobin. Hemoglobin is a protein, and that's what carries oxygen on your red blood cells. So the oxygen binds to your hemoglobin, and the hemoglobin transports the oxygen to all of your tissues, right? So oxygen is another thing that the body cannot exist without. Some other things that, insulin. Insulin is a protein. So insulin is what's produced by your pancreas in order for you to be able to process sugar in the body, right? So that sugar, when you eat sugars or carbohydrates, or if your body is breaking down foods into sugars, that sugar needs to get from your bloodstream into your cells to be used as energy. And insulin is like the key that opens the door to the cell that lets the sugar in. If you're insulin deficient, you're going to have high blood sugar, also known as diabetes. So these are just a few things that protein does in your body. Every single cell in your body has protein in it. It helps form the structure of the cell. Protein transports molecules, so it acts as a transportation system. It helps regulate fluids in your body. It helps regulate your chemical balance. We already mentioned immune function. Your hormones are made partly out of protein. Your enzymes, so enzymes, most people know enzymes as something digestive related, right? So when you eat a meal, your digestive tract secretes enzymes that helps you to break down the food and digest the food and break down the nutrients so you can absorb it. But enzymes do a lot of other things in your body besides digestion. Enzymes are like catalysts, meaning that they make systems go, they make processes go. So a lot of enzymes are made out of mostly protein. And then of course your blood cells, we mentioned hemoglobin. Now protein can also be used for energy in your body. So the main source of energy coming from your food is carbohydrates, and your body also converts fat into energy. But if you don't have fat or carbohydrate available, the body can actually use protein for energy. And if you're starving yourself, the body will start breaking down the parts of you that are made out of protein and consuming it for energy. So that's when, let's say you're starving, for some reason you're either fasting for too long or you have some reason that you can't eat, and your body will start eating away muscle. So muscle is made mostly out of protein, right? And that's where you see muscle wasting. So signs of deficiency in protein deficiency would be that muscle weakness or wasting, loss of muscle mass, fatigue, and depression and anxiety can also be signs of protein deficiency. So a few videos ago we talked about stress management, and symptoms of anxiety and depression in relation to mineral deficiency. And we also mentioned in our last video about fat, how fat deficiency can lead to symptoms of depression and anxiety and insomnia. But guess what? So can protein deficiency. Now the bottom line is nutritional deficiency causes symptoms, and the symptoms oftentimes are depression, anxiety, other emotional symptoms, attention deficit, brain fog, insomnia. So symptoms that we see as emotional or mentally related. And then also a symptom of protein deficiency would be immune dysfunction. So people that get sick a lot may be due to protein deficiency. And protein deficiency can happen for a variety of reasons. One is that you're not eating enough protein. Two is that you're not eating the right kinds of proteins. And three, your body cannot digest or metabolize protein. So we talked about enzymes earlier. You need enzymes for digestion, and if your body is not producing enzymes correctly, you may not be able to actually metabolize protein, right? So that's a problem that needs individual attention, and it's something that I see very often in my practice from people coming in complaining, especially men complaining that they're working out and they're not building muscle the way that they would expect to. And what we find is that they're not able to absorb protein well, or they're not eating enough. I have a lot of patients who are runners, avid runners. So when you're exercising heavily, you need more protein because you're placing such a demand on your muscle, and your muscles are made out of protein. So if you're exercising heavily but you're not eating enough protein, your body is going to use the protein you are eating for other more important things than building muscle. And by the way, your heart is a muscle, so your heart is also made out of protein. So your heart would get the protein before your skeletal muscle gets the protein, right? And then your immune system and all the other things that we mentioned earlier. So one of the most abundant, or the most abundant proteins in your body is collagen. Collagen makes up your bones, your tendons, your ligaments, your teeth, your hair, your skin, your nails. It also helps with other functions in the body. It helps with blood clotting, wound healing, formation of scar tissue. Your blood vessels have collagen in them. So collagen is an extremely critical protein that a lot of people don't get enough of, because where does collagen come from? The best sources of collagen are the parts of an animal that most people do not eat anymore. So cartilage in the animal, the organs, the organ meats, the skin and the bones of the animal, and the bone marrow, the connective tissue, the tendons and the ligaments. So this is something that I find very fascinating, that those kinds of foods, what I just mentioned, the organ meats, the bones, the bone marrow, the cartilage, all of those things that people don't eat a lot of, contain an amino acid called glycine. So that is the richest source of the amino acid called glycine. And because most people do not eat a lot of those foods, a lot of people are deficient in glycine. So when people are eating animal protein, they're mostly eating muscle meat, right? That's the primary source of animal protein that these days that people are eating. And muscle meat is very high in the amino acid methionine. So here's the problem though. If you're getting too much methionine and not enough glycine, when you have an imbalance, it actually causes your homocysteine level to become elevated. So homocysteine is something that you might have heard of. You get blood work and let's say your medical doctor tells you your homocysteine is high. That means that you are possibly at risk for heart issues, for clogged arteries, for blood clots forming. And by clogged arteries, we mean damage to the inside of the artery with high homocysteine. So eating glycine-rich foods balances the methionine levels in your body and helps to lower your homocysteine. And glycine has other health benefits as well. So it's been shown to cause improvements in sleep. So think about that for a minute, right? So when we say protein deficiency can cause insomnia, protein is made of amino acids. Glycine is one of the amino acids that people are deficient in. So increasing your glycine intake if you do have insomnia might help. It also aids with detoxification, with digestion. It helps to repair leaky gut, and gut health, wound healing, and even stabilize blood sugar. So assuming that you are not eating animal meats, and it's what we call a traditional diet, the way people ate in not even just prehistoric times, what's known as a paleo diet, right? Before there was technology, before there was any kind of food processing, Paleolithic humans. But even up until, it's really not that long ago, and some cultures still do it, what's called nose to tail eating, where people would eat the entire animal, and that's what animals do in the wild. They eat the entire animal from nose to tail. So it's estimated that traditional peoples, let's say tribal populations that were untouched by processed food, by civilization, got about 45 to 65% on average of their protein from animal foods. And that would include all parts of the animal. So I just want to read to you, because I don't have it memorized, the 9 essential amino acids that you need to make sure that you're eating. And they are histidine, valine, isoleucine, leucine, phenylalanine, threonine, methionine, and lysine. So if you want to play that back slowly and just take note of it, interesting also that lysine is used as a supplement for people that have herpes and cold sores, right? So this is part of what we're talking about, how protein interacts with the immune system. So if you're deficient in lysine and you have an issue with herpes, if you get cold sores frequently or outbreaks, you may have a lysine deficiency. Taking lysine supplements helps, but really the best thing to do is to make sure that you're eating a wide variety of proteins. And one of the best ways of getting all of your proteins, including glycine, is with a good quality bone broth. So it's really rich in glycine and other of the amino acids, and it has a whole bunch of other good stuff in it, all kinds of nutrients, vitamins, and minerals. So it's not that hard to make your own bone broth. You can just Google recipes, but if you want to purchase it already made, one of the better quality brands is called Kettle and Fire. So bone broth is readily available, already made these days. Now, I have to address the issue of veganism. So I do not purport the notion in any manner, shape, or form that veganism is bad or wrong or anything like that. However, it is challenging. It is challenging to make sure that you're getting enough protein in all of your amino acids on a vegan diet, and I'm going to tell you why. That said, I want to say that I have patients who are vegans who are very conscious about how they're eating and what they're eating, and some of them are doing fine, and other of my vegan patients are struggling with their health. I did try it myself for a while. It didn't work out for me. I would love to be a vegan. I love animals. I don't really like the idea of eating animal. But what I do is I eat animals that I know are being raised humanely, that are treated well, that are handled properly, that are fed correctly. So that's how I handle it in my own life. But if you do feel that you need to be a vegan or want to be a vegan, I'm just going to give you some data that I have done a lot of research on this just because I've had to help patients with it. So first of all, probably vegans, if you are a vegan or a vegetarian, you know it's hard to get some of your nutrients. It's hard to get your fat-soluble vitamins from a vegan diet, which are vitamins A, D, E, and K. Right? So for vitamin A, a lot of people think, oh, I could get that from carrots, but that's not exactly true. You get beta-carotene from carrots, and beta-carotene metabolizes into vitamin A in the body, but not that readily and not that well and not that much. So you may not get enough vitamin A from a plant-based diet. So those 4 vitamins, A, D, E, and K, are hard to get. Also, vitamin B12 is mostly only found in animal foods, although nutritional yeast also has vitamin B12 in it. Now, I do want to say that based on my research, almost all traditional diets contain animal, and those that were more plant-based, so we're talking about tribal cultures that were more plant-based, maybe because animals were not readily available to eat or weren't always available, they would eat insects and grubs. So insects and grubs are a good source of protein. Now, whether or not you want to eat them is another story. There is cricket protein powder available that you can purchase. Personally, it's not something I don't think I could do. I mean, I don't know. It's not, let's just say I'd prefer not to, but it is a good source of protein if you are willing to eat that. So when you are getting most of your protein from plants, you generally can only utilize 13 to 15% of the protein in the plant, whereas when you're eating animal protein, you can utilize 35 to 45% of it, which means that if you're eating only a plant-based diet, you have to eat a lot more foods. And in order to get all your amino acids and get enough of them, you have to eat a lot of food. So the trouble comes in for some people because they can't eat that much. It's like, it's too much food. There are some plant foods that have complete proteins in them, which means all the amino acids. So that would be quinoa, chia seeds and hemp seeds, and spirulina. So but still, you have to eat a lot of it to get enough protein, because there's lesser amounts of protein in those foods. So lastly, I just want to talk about quantity, because a lot of people ask me, how much should I eat? And there is no one right answer to that question, okay? Because it depends on what your gender, it depends on your size, it depends on your activity level, it depends on your age, it depends on whether or not you want to lose weight. So I'm just gonna give you some rough guidelines, all right? So for a very big active guy, somewhere around 56 grams of protein a day. And then for somebody that's a sedentary man, so when I said big guy, I meant man. For a sedentary man, a little less, more like 47, so about 10 grams a day less. Women would be even less, so maybe an active woman around 45. If you're trying to lose weight, less. And then for growing children need more. They need like 65 grams of protein today, and pregnant women need more as well. So if you are pregnant, you have to make sure you're eating enough protein, because obviously your baby is being made out of protein. The conventional dietary guidelines, if you look them up, will recommend higher amounts than I just mentioned. And that's because the sources of protein that they recommend are based on things like muscle meat or lean proteins. But when you're eating the way that I'm suggesting, from nose to tail, or you're adding some collagen to your diet, which you can get from bone broth, gelatin, or even collagen, good quality collagen powder, then you actually need less grams, because you're getting more per serving, if that makes sense. And by the way, I do eat collagen powder every day, so that's one of the ways I maintain my girlish hair and skin. And I'm not recommending any brands, I'm not doing a commercial, but I prefer the Axe Multi-Collagen and the Primal Kitchen collagen. Those are my two favorites. Collagen, there's actually different types of collagen. I wasn't planning to talk about that, but there's type 1, type 2, type 3, and they each do, different process in your body. So the Axe Multi-Collagen has all the different types in there, and the Primal Kitchen is mostly types 1 and 3, which is a more hair, skin, nail, joint formula. But again, I'm not endorsing either one. I just personally like them, and that's what I'm eating. And I just want to close with saying that if you are eating animal proteins, please do try to choose very carefully. Quality is so important. If you're eating eggs, which is a great source of protein and other nutrients, eat the whole egg, including the yolk, and make sure you're getting good quality pasture-raised eggs that are fed the correct food. If you're eating other meats like beef, make sure that you're getting grass-fed, free grazing, well-treated animal meats, and try to eat as much, if you like organ meats, try to eat organ meats as well for the best possible outcomes for your health. So I just want to ask you, I'm not doing this channel for any purpose other than to help you with information. I don't care about any kind of compensation, but I would really appreciate it if you would share and subscribe and like, because the channel's growing slowly, but it's really slow, and it would make me happy if I knew more people were watching it. So sharing it would be wonderful. And I am sure you know people that need this information, right? Pretty much everyone. So again, I thank you. I'm going to be having a special guest, I think, on my next video. And it is a medical doctor who quit the medical profession because of what he was seeing going on there. And I'm really excited to have him on the show. And I will make an announcement prior to doing it. I don't want to promise it because I don't have it written in stone yet, but if that doesn't happen, I will come up with another really interesting, amazing topic to talk to you about that might be like what I said, sexier than proteins. So I hope you are all doing well. Stay in good health, eat cleanly, stay away from chemicals, and I will see you again soon, I hope.